Hello, my name is Danielle van Andel. I'm a pelvic floor physiotherapist, and today we are going to talk about incontinence. Incontinence is the involuntary loss of urine or feces, and today we are going to discuss urinary incontinence. We are going to talk about the two most common types of incontinence. These are stress incontinence and urge incontinence. Stress incontinence is leaking with coughing, sneezing, laughing, jumping, lifting. Anything that causes increased pressure in the abdomen or a lot of pressure downward, for instance, through impact. It is usually associated with some sort of movement or action. Stress incontinence is a pressure issue. There's more pressure created by gravity, for instance, impact, or intra-abdominal pressure, for instance, coughing, laughing, sneezing, or sometimes lifting something heavy, than can be supported by the support structures, such as the ligaments or connective tissue of your bladder or your pelvic floor muscles. It can be about too much pressure, not enough support, or a combination of the two. Urge incontinence is leaking associated with an uncontrollable urge to go to the bathroom or leaking on the way to the bathroom. One of the main treatments involves pelvic floor muscle training. So at its most basic level, this is kegels. And for some people, doing kegels on your own may be very effective. If it's not effective doing them on your own, that doesn't necessarily mean they won't be helpful. With stress incontinence, the issue can be pelvic floor strength, but it can also be that you don't have good endurance in those muscles, that they don't relax well, or that they're just not kicking in at the right time. Working with a pelvic floor physiotherapist can be really helpful in this. First of all, the physiotherapist will make sure you're actually activating the right muscles. Your pelvic floor muscles are really small, and most people who've done any sort of weight training are used to training big muscles. So they're used to feeling something happen when they're doing an exercise. If you're expecting to feel something happen similar to doing a bicep curl, you're going to do your kegels wrong. You're going to activate bigger, stronger muscles instead. Your pelvic floor muscles are similar size to the muscles in your face. So if you smile, that's about as much movement as you should expect to feel with a kegel. If you're feeling more than that, there's a reasonable chance you're trying too hard. So that's one aspect that a pelvic floor therapist will assess is, can you effectively find your pelvic floor muscles? Your pelvic floor physio will also look at the endurance of these muscles. Endurance is how long can you hold or how many times you can repeat. And that's just as important as strength. They will assess your ability to relax these muscles. If you can't relax a muscle well, you only have one good contraction in you, and that's not enough for daily life. And then the last piece is timing. If your pelvic floor muscles don't kick in at the right time, you're still going to leak. If they don't kick in with your cough, they're not able to provide that support. So that's how a pelvic floor physio will help you address the support from underneath. Your pelvic floor physio may also look at addressing how much pressure is being created by above. So this may be looking at things like breathing techniques, posture or positioning. either in general or when doing specific exercises or activities. There are other treatments available for stress incontinence. These can include surgery, as well as an incontinence pessary, like the Uresta. An incontinence pessary is basically a device that's inserted into the vagina, either all day or only when you need it, for instance with exercise, that provides extra support to the bladder to help keep you from leaking. We treat urge incontinence by treating the urgency, and there are many different components to this. One component is assessing the pelvic floor, and that's very similar to treating stress incontinence. But we'll also look at things like bladder irritants. So there are foods and fluids that will aggravate the bladder. The most common ones are caffeine, or in some people, decaffeinated beverages, carbonation, alcohol, acidic foods, sweeteners, sugar or artificial sweeteners, and spicy foods. These are incredibly individual person to person. So you kind of have to test them each out for yourself. Another aspect that we'll address is hydration habits. If you're drinking a huge amount, it's got to come out somehow. If you don't drink enough, your urine becomes more concentrated, and that irritates the bladder. And that can really contribute to urgency as well. Everybody has a happy medium, and you need to find that happy medium for you. We will also do some brain retraining to help your brain better interpret how much is in your bladder. One of the things that often happens with urinary urgency is the brain becomes so focused on making sure the bladder is empty that it starts to warn you as soon as there's any amount of urine in the bladder. Another piece that's really important to note here is that it is very normal to have some urine left in the bladder after peeing. You will always be able to get something more out. And just because you can get a couple more drops out doesn't necessarily mean you should be getting those last couple of drops out. The other piece of brain retraining is training yourself to get the urge under control. So this may involve some really specific techniques to calm down that urge. We also look at addressing the emotional components of urge. We have this vicious cycle where the more anxious you are to get to the bathroom, the worse urge becomes, the more likely you are to leak, the more anxious you become about getting to the bathroom. And so we want to really start to address that cycle. It's also really common for anything that aggravates stress, anxiety, or fear to trigger urge. So if these are an issue in your life, looking at addressing them can often be really helpful. It's also important to rule out a urinary tract infection, as that will trigger issues with urge and can often trigger urge incontinence. Surgery is generally not effective for urge incontinence. It is generally only effective for stress incontinence. But there are medications that can be effective in urgency and urge incontinence. So if you'd like to learn more about those, talk to your doctor. If you are doing kegels on your own and they seem to be making anything worse, please stop doing them and see a pelvic floor physiotherapist. There are some people for whom kegels will make things worse or create new symptoms. And if this is you, doing more kegels is not the answer. Thank you for watching this video on incontinence. For more information, please contact your local pelvic floor physiotherapist or your doctor. And be sure to check out the other videos from Women's Health Education Made Simple.